हाय गाईज, हाऊ आर यू ऑल? होप फाईन. आज आपण एक खूप महत्त्वाच्या आजाराविषयी डिस्कस करणार आहोत. दॅट इज कॉल्ड ॲज द वॉमिटिंग इन चाइल्डहूड इन्फन्सी. जास्त करून पॅरेंट्स डॉक्टर्सकडे एक कंप्लेंट वारंवार घेऊन येतात, ते म्हणजे बच्चू वारंवार उलट्या करतो. तर हे वारंवार उलट्या करण्याचे कारणं काय आहेत, मग ते कसे ओळखायचे ते आपण ह्या व्हिडिओने समजून घेऊया. First, what is vomiting? Vomiting is the forceful expulsion of the contents of the stomach through the mouth due to vigorous contraction of the abdominal muscles. This is called as vomiting. Now, the causes of vomiting we had divided it into according to the age of the bachchu: neonatal period, post-neonatal period, and early childhood. First, you should understand what is neonatal period. Who is a neonate? Neonate is the newborn bachchu from the day 1 of the birth to 1 month. It's called as neonate. From 1 month to 1 year is called as post-neonatal period, and from 1 year to 8 year it is called as early childhood. So the causes differs according to the period. Now in neonatal period, the causes of the vomiting may be divided into two things. First is the non-organic and second is the organic. So what are the non-organic causes of vomiting in neonatal period? In non-organic causes, the neonate vomits because of during delivery the neonate may ingest the amniotic fluid, may ingest the meconium. Okay, so the bachchu vomits, and maybe faulty handling also. The mother doesn't आईला अजून सवय नसते बाळाला हँडल करायची. The faulty handling or difficult handling may also produce vomiting in the infant, that is neonate. Then these were the non-organic causes. Now we will study the organic causes. These organic causes, they are divided into mechanical, neurological, and metabolic. So we will study first the mechanical causes are very important in case of vomiting in neonatal period. How that we will say. See, in the mechanical causes, the first cause is this congenital abnormalities of the esophagus. इसोफेगस म्हणजे बाळाचा फूड पाईप, एक विंड पाईप असतो, एक फूड पाईप असतो इन लेमन्स आयडिओलॉजी. देन तो फूड पाईप जो असतो त्याचे आजार असतात. हे कंजेनाटल ॲबनॉर्मॅलिटी असते, लाईक इसोफेजल अट्रेशिया, स्टेनॉटिक लिजन्स ऑफ द इसोफेगस, ट्रॅकिओ इसोफेजल फिस्चुला. These things may require immediate surgical reference and immediate surgery may also be required. तर ह्याच्यामध्ये कसं ओळखणार आपण की बाळाला हे आजार झालेत, ही ॲबनॉर्मॅलिटी आहे? जेव्हा बाळ वॉमिट करेल ना, तेव्हा त्याच्या तोंडाच्या जवळ असा फेस येणार. जर तोंडाजवळ फेस येतोय, वारंवार वॉमिट केल्यावर बाळाच्या तोंडावर फेस येतोय, तर लगेच आपण IT टाकायची. अँड IT इन्सर्शन इज नॉट पॉसिबल इन केस ऑफ दिस ॲबनॉर्मॅलिटीज. IT insertion is not possible. If the IT cannot be inserted, you should immediately refer the bachchu to the pediatric surgeon. It requires a immediate pediatric surgical reference. अदर डिझीज कॉल्ड एज अचेलिझिया कार्डिया. अचेलिझिया कार्डिया नावाची ही जी ॲबनॉर्मॅलिटी बच्चूमध्ये असतो, जेव्हा इसोफेगसचा लोअर एंड इट फेल्स टू रिलॅक्स. जो इसोफेगसचा लोअर एंड असतो तो स्टमकमध्ये रिलॅक्स होतो, स्टमकमध्ये ओपन होतो, दॅट फेल्स टू रिलॅक्स अँड इट कॉजेस रिगर्गिटेशन, इट कॉजेस वॉमिटिंग. देन अदर इज नेक्रोटायझिंग एंटेरोकोलायटिस. दिस इज वन ऑफ द रिझन. नेक्रोटायझिंग एंटेरोकोलायटिस म्हणजे काय? इट इज द bacterial infection of the inner intestinal wall. So this may be the cause of vomiting in neonatal period. The another disease is called as Hirschsprung disease. This is also one of the cause of vomiting in neonatal period. It also requires a surgical reference. It is a congenital abnormality. So these were the mechanical and very important causes of vomiting in neonatal period. These were mechanical causes. Then others might be neurological causes. आता न्यूरोलॉजिकल कॉजेस कसे? डिलिव्हरी जेव्हा होते बाळाची, तेव्हा ड्युरिंग बर्थ ट्रॉमा, इट मे कॉज वॉमिटिंग. देन दिस थिंग हायड्रोकेफॅलस माइट बी देअर, so it may be one of the cause of vomiting. Bilirubin encephalopathy, this is one of the cause of vomiting. So there are so many causes. These were the neurological causes. Then we will study the metabolic causes. Metabolic causes like hypoglycemia, hypercalcemia. Inborn errors of the metabolism may lead to vomiting. So these are also the causes of vomiting. इन्फेक्शियस कॉजेस. इन्फेक्शनमध्ये बाळाला सेप्टिसेमिया आहे, बाळाला मेनिंजायटिस आहे, एन्केफेलायटिस आहे, टॉक्झोप्लाझ्मोसिस आहे, सायटोमेगालो इन्फेक्शन आहे. सो वी हॅव टू डिफरन्शिएट what is the cause of vomiting, and the treatment will depend upon the cause. So these were the causes of vomiting in the neonatal period. We will see the post-neonatal period. Post-neonatal period means what? Which period? It is that period from the 1 month of the बच्चू to 1 year. It is post-neonatal period. पोस्ट-न्यूनेटल पिरियडमध्ये नॉन ऑर्गॅनिक कॉजेस काय असणार आता? नॉन ऑर्गॅनिक कॉजेस म्हणजे फर्स्ट कॉजेस द रिगर्गिटेशन. सी, बाळ अजून 1 महिन्याचं झालेलं आहे. आईला बाळाला व्यवस्थित हँडल करणं जमत नाही आहे. आई बाळाची बर्पिंग करत नाही आहे. बर्पिंग मीन्स एव्हरी टाईम बाळाने दूध पिल्यानंतर त्याचा ढेकर काढायचा. तो ढेकर नाही काढला तर बाळ वॉमिट करतो, त्याला अनइझी फील होतो ॲबडॉमनमध्ये. So burping is very important. So this is one of the cause of vomiting. Then overfeeding. आईला अजून समजत नाही आहे की बाळाचं पोट भरलं आहे, आई तरी बाळाला दूध पाजते, तर that is also wrong. So overfeeding may be the cause of vomiting. So these are the non-organic causes. We will study now organic causes. Organic causes are same as of the neonatal period. कधी early diagnosis is not possible. We can't on the clinical basis early diagnosis is not possible. So postnatal period the same causes: achalasia cardia, tracheoesophageal fistula, stenotic lesions of the esophagus, esophageal atresia, and one more cause is there, that is called as a hiatus hernia. Now what is hiatus hernia? Hiatus hernia, normally the esophagus म्हणजे जो food pipe असतो, that's a lower end, it opens in the upper part of the stomach below diaphragm. But hiatus hernia मध्ये काय होतं, ही जी ओपनिंग असतं that is above diaphragm, which leads to vomiting in children. So this is one of the cause in the post neonatal period of mechanical causes. Now second might be infectious causes. Infectious same, that is septicemia, meningitis, encephalitis, cytomegalotoxoplasmosis. Okay, these are the infectious causes. Metabolic causes, inborn runners of the metabolism. Then what remained? We will study the causes of vomiting in early childhood. And also neurological causes in the, what are the neurological causes in post neonatal period? The neurological causes असू शकतात like space occupying lesions. Space occupying lesions म्हणजे निओप्लाझम्स, ट्यूमर असं जर असलं तरी पण बच्चू वॉमिट करणार. ड्यू टू रेज्ड इंट्राक्रॅनियल प्रेशर द बच्चू विल वॉमिट. These are the causes. Now in early childhood, what are the causes? Early childhood means that period from 1 year of the child till the 8 year of the child. Early childhood. So what are the non-organic causes? Non-organic causes might be, first non-organic causes is sometimes कधी कधी बच्चूला neglected feel होतं. He feels neglected, so he tries to catch the attention of his parents and he will do some extraordinary things. Okay, like he will try to vomit. That is a psychological cause. He will try to vomit. He doesn't actually vomit, but he try to vomit. So this is one of the cause of vomiting in early childhood. And if this symptom is severe then it takes the form of attention deficit hyperactive disorder. Attention deficit hyperactive disorder is a psychological disorder in children, which when the children feels neglected, it tries to catch the attention of the parents and they do some extraordinary things repeatedly. That is attention deficit hyperactive disorder. So this is one of the cause of vomiting. Now organic causes might be acute pancreatitis, acute appendicitis, then all bacterial infection, viral hepatitis, all viral infections. Again the same, cytomegalotoxoplasma. Okay, the same. And in the one more cause is there in the from 1 year to 8 year childs, which requires a early surgical reference. That is intersusception, volvulus, midgut volvulus, intestine twist होतात, or intestinal obstruction. It requires immediate surgical reference. These may be the cause of vomiting. Okay, in the aged child from 1 to 8 years of age, which requires immediate surgical reference. Then the other causes are same. Then toxic cause may be there. One of the causes which might be food poisoning. Okay. Then chronic intestinal pseudo obstruction. So these are the causes. आपण कसं ओळखायचं की वॉमिटिंग, आता सपोज ग्रीनिश वॉमिटच झालं बाळाला, by the color of vomiting we can diagnose what is the cause of vomiting. If the vomitus is greenish yellow in color, then the cause is intestinal. Okay, intestinal cause, bile stained vomitus hai, then the cause may be intestinal. And if the vomitus is sudden, forceful and projectile, then it may be the neurological cause. Why projectile? Because of raised intracranial pressure, the bachu will vomit forcefully. That is a projectile vomiting, and this we can differentiate it from other vomiting. So likewise we can differentiate the causes. One more thing is there in the childhood. There is a one common thing is there, that is a lactose intolerance. Now what is lactose intolerance? Lactose intolerance is a inherited disease. From the birth, the bachu will deny to ingest the milk, and he will vomit out. So this is lactose intolerance. And how will you manage the cases of vomiting now? See, vomiting, we have to manage the case according to the cause. First, due to the repeated vomiting, the bachu will get dehydrated. We have to treat the dehydration. First, bachu is vomiting and bachu is playful. Then there is no reason to admit the बच्चू. But if the बच्चू is lethargic, बच्चू सुस्त हो रहा है, बच्चू खेळतो आहे, प्लेफुल आहे, तर काही प्रॉब्लेम नाही. पण बच्चू सुस्त होतो आहे, तर देर इज अ प्रॉब्लेम अँड यू हॅव टू इमिजिएटली ॲडमिट द बच्चू. यू हॅव टू रिहायड्रेट हिम बाय रिंजर लॅक्टेट सोल्युशन वगैरे. हे सगळे आय व्ही स्टार्ट करतो आम्ही बच्चूला ॲडमिट करून. अँटी ॲमेटिक्स स्टार्ट करतो. अँटी ॲमेटिक्स कोणते? डिहायड्रेशन कसं ओळखायचं पहिले बघूया आपण. तुमचा बच्चू डिहायड्रेट झाला आहे, तुम्हाला कसं कळणार आहे? बच्चूची टंग ड्राय होते, बच्चूचं युरिन आउटपुट युरिन आउटपुट स्टॉप होतो. ओके, बच्चू रडतो पण डोळ्यातनं अश्रू निघत नाही. युरिन डार्क कलर्ड असतं, बच्चूची आईज सनकन जातात. when we prick the skin it shows the signs of dehydration. वेट लॉस, सनकन आईज, हे सगळे एक. आणि इफ देर इज अपेंडिसायटिस देर विल बी विच येल्लो कलर वॉमिटर्स. तर हे सगळं आपण बघावं लागतं आणि त्यानुसार त्याची ट्रीटमेंट दिली जाते. सो आफ्टर ॲडमिशन, if the bachu is having dehydration, we have to give a rehydration therapy by starting our IV fluids. We have to restore the electrolyte balance. We give Pedialyte sachet वगैरे देतो आम्ही to restore the rehydration. Then certain antiemetics are started. Certain antiemetics like metoclopramide, there is and ondansetron, that is the 5-HT3 antagonist. Okay, if the vomiting is due to motion sickness, काही बच्चे करताना वॉमिटिंग होतं, दॅट इज ड्यू टू मोशन सिकनेस, त्यांना आम्ही हे देतो प्रोमिथॅझिन. सो दे लाईकवाईज दिस ड्रग्स हॅज टू बी स्टार्टेड. डोमस्टाल देतो, डोमस्टल ड्रॉप्स, ऑनडॅम ड्रॉप्स, हे सगळे ट्रीटमेंट डिपेंड्स अपॉन द कॉज ऑफ द वॉमिटिस. सो दिस वॉज वॉमिटिंग. थँक यू व्हेरी मच. हां, अँड वन मोर थिंग, देर इज अ ब्रॅड डाएट. While managing the cases of vomiting, if the bachu is between 1 year to 8 years, we are starting a BRAD diet to the bachu. Now what is this BRAD diet? BRAD, B means banana, A means apple juice, R means rice water, and T means toast. So these things we have to smash and give to the children. This is called as the BRAD diet. Thank you so much.